Hi, this is Stephen Rankin. I'm a doctorate of occupational therapy, doctorate of health science with an MS in exercise physiology, human performance, and I thought this might be relevant to actually all of the above. Many of the adults who have glucose management issues believe that they have to do long, sustained exercise protocols to manage their blood glucose, and that's not the case. In fact, as you'll see, HIIT and resistance training may be a superior method of controlling blood sugar. So this is actually part of a program I'm engaged in now in advanced exercise and sport physiology and pathophysiology through American Military University. And if this is interesting to you, I have a paper with other references and more detail. Feel free to contact me. Okay, over the next few minutes, we'll examine the differential effects of high intensity interval training and resistance training on glucose metabolism. Both may have benefits. Comparing the characteristics of the two may be interesting, and the overall effect of improving glucose may be enhanced by doing both. This is particularly important for those with diabetes or prediabetes, and it should be noted that some people may not be able to engage in such high intensity exercise, in which case the sustained endurance type exercises, walking, slow running, those types of things may be more appropriate, slow cycling. And there are many different ways of doing this. This is, from a time perspective, much more economical and effective. And this is also somewhat new in terms of what the recommendations have been over the years. As many of you are aware, those of you who are therapists and work with patients who are diabetic and see the complications, those of you who are physiologists and have studied this, heart disease, stroke, kidney damage, many other pathologies are related. According to CDC, over 34 million Americans have diabetes. 90 to 95% of them have type 2, which is the type which is easiest to manage and, as you'll see, in some cases preventable or reversible through the application of exercise. Okay, so what's this all about? What's the real problem here? Over the decades, we've understood that the use of sustained exercise, endurance type activities, use blood sugar. However, they also increase cortisol. HIIT, high intensity interval training, and resistance training do not do that. In fact, they are much less efficient, which is a good thing when it comes to exercise. You want to burn as much energy as possible, and they're much less efficient. So they preserve muscle, they increase the production of glycogen. I mean, there are many methods, many avenues that this is a superior way of possibly training, not to mention the fact that the economy of time, you spend much less time doing sprints than sustained exercise. So resistance training and high intensity interval training may be a superior method for most people. So how does this work? Well, both HIIT and RT, resistance training, have similar effects with regard to glucose sensitivity. Both improve sensitivity, which means you simply use your glucose better. Resistance training may do it in somewhat of a different way. Fiber recruitment being higher throughout the body may actually improve receptor site sensitivity in throughout a greater mass of tissue. The acute effects, well, both, in fact all three, if you look at endurance training, reduce blood glucose. They depend on, there is somewhat of a deficit when it comes to glucose used through glycogen focused activities like sprint training. And resistance training, once again, is even less efficient as far as using glucose in the fact that there's an absence of oxygen. So there's a debt also incurred to some degree. Glycogen upregulation happens with HIIT training, also with resistance training. So both improve glucose regulation, and resistance training may have the edge on improving the active amount of muscle over time. So that's a chronic effect. So something discussed to a lesser degree is the ability of HIIT and resistance training to actually reverse diabetes. Muscle mass increases, receptor sites increase, resistance to insulin goes down, there's greater insulin or greater glucose utilization. So this may be another advantage of this type of training over endurance training. So a possible framework and mechanics for using HIIT and or resistance training. Keep in mind that a single resistance training workout improves insulin resistance, so it decreases resistance. HIIT and RT resistance training also improve fasting glucose levels. This may not be the case with endurance exercise, which exceeds 45 minutes and may increase cortisol levels, liberating glucose. Short, high-intensity exercise does not spike cortisol. Resistance training may better address mitochondrial dysfunction, which is actually the long-term cornerstone of insulin resistance. HIIT may better address fat oxidation. Both combined is probably superior to either one. There are hormonal changes related to atropine, blood glucose, glycogen synthesis that may increase the production of glycogen, the stored glucose, so that it's not liberated in the bloodstream and causing problems. If it's too intense, sympathetic factors may negatively influence blood glucose, and this is highly individual. Some people just react to it with an exaggerated stress response and have higher blood glucose levels as a consequence. So this has to be tailored to some degree. Higher intensity is better for long-term control than moderate. So those two may seem somewhat conflicting, but once again, it has to be tailored. Fasting glucose of HIIT is superior in untrained, so the more you do this, the less of an effect you have, which stands to reason. And the same with resistance training. The more you resistance train, the fewer benefits you stand to gain, but you need to continue to at least maintain those. 2 to 3 days per week is sufficient for resistance training or HIIT, so you don't need as frequent an activity level as you would with sustained or endurance exercise, and you need time to recover. Cortisol levels can go up in events of overtraining. Hypoxia, such as that that occurs with HIIT, may be a mechanism that improves glucose transport. And these are all things that could be further examined and are included in the paper if you want a list of references.
A few practical take-homes from this paper. If you want to put together some guidelines, both acutely and chronically influence insulin sensitivity. HIIT and RT are both effective. Both require a day or two to recover from, so it may not be possible to do them in a non-staggered way without overtraining. HIIT has a glycogen pathway influence. Resistance training is more phosphogenic in focus. Both may improve or increase the effect of overtraining and stimulate cortisol, so high intensity days consecutively done may not be favorable. RT's action on hypertrophy may have a complementary effect on HIIT, so if you have more muscle and you activate that muscle, it may actually improve the glycolytic ability of HIIT as well. Both better preserve muscle mass than endurance or sustained training. A couple very important take-homes related to safety and programming. Despite the benefits, high-intensity interval training may damage organs in frail individuals. This was discovered in rat models where they looked at them, they had benefit, however, they had damaged kidneys. Low rep, high-intensity resistance training or low rep, high-intensity resistance may stiffen vessels and may be hypertensive, which may be a negative effect in some of those populations. HIIT hypoxia may be the beneficial activity that's wanted as far as effect goes, but it may be dangerous for the frail. Resistance training may include entire body training and splits, and this wasn't examined. Either may require monitoring hyper or hypoglycemic states acutely for safety of the individual. Resistance training's action on hypertrophy may be a desirable effect for both and have a chronic overall benefit for HIIT training. Both require tailored programming based on safety and benefit. Let's discuss what this means. So, more research is obviously needed to examine the combined influence. Research related to organ stress and hypertension for both HIIT and RT are needed. Either is effective, both in a combined approach may be superior. Recovery from integrated training may be important because most programs look at either resistance or HIIT, but what's the recovery interval for both together? Dose and duration are important when exercise is medicine, so looking at how much, how long, and some of this may be individual. Individual monitoring is also important, but variable. Some are more fragile than others. Some may have a hypoglycemic or a hyperglycemic influence from this type of training. There are non-responders. Some people just don't respond as well to others. And individual goals and tolerances should be a consideration, with MD clearance an absolute necessity when working with a population that may be at risk.
I did include in-text references, but I have probably about 30 that go with the accompanying paper that this is based on. If you're interested, this is very simplified and basic information. Some of it, if it seems complicated, is because it's from an academic program. If you need more guidance, more information, feel free to contact me. I'm going to provide an email below, some contact information. You can also contact me through my LinkedIn page. All right, I appreciate you. I hope that you found this useful.